leave them at Hello.
Good afternoon, everyone.
Good afternoon.
Hey, welcome to the 1 o'clock Wednesday session, which is the exact same as the other sessions held previous to this. So if you are joining us for the first time, so I want to let you know that if you've missed the previous sessions and any upcoming sessions after this, which will be the 2 for tomorrow, 9 and 11, these are all the same information is being provided.
Yes, ma'am.
So I'm gonna get started, and I'll start off with an introduction to myself. I'm just getting my little note page together here. For anyone who doesn't know me, to make sure everybody knows who I am. My name is Siobhan Humphrey. I am the GOEA HCBS program manager. I lost my words. I forgot who I was. The HCBS program manager. And I started with GOEA in 2007. So in my first experience with GOEA, I was a program auditor. And I've done some other things in between. Left GOEA, came back. I've done legislative auditor work, Louisiana legislative auditor, and then Department of Revenue, did bankruptcy and taxation. And then I've come back to GOEA, and I've taken my time to be nosy enough to learn a lot of things that are what you all do, supports what the different positions in GOEA does. So I made a conscious effort to figure out what the struggles for the agent network have been, could be, will be. And I set up these calls after meeting with my staff and going over a lot of things to see how we could get you guys reset. So, oh no, I'm sorry. I probably clicked the screen, and if I clicked you to ask you to unmute, that was just an accident. My screen was moving around. So, all my years of experience with GOEA is what we have applied and considering what we could do to help you guys. So this call is about the changes that are coming forward, all of the imposing we may seem to do on you, asking you to do something like register for this call and stop and insert some time in your day to see me, whether it be now, and if it's not the most convenient time, let me know, and then we'll do it again, and to give you some information that should help you move forward to close your year out with the remainder of your ARP dollars. So one of the biggest things that we're doing is becoming familiar with the new ACL regulations. So the update from the ACL standpoint means that every organization associated with aging network services throughout the entire United States of America must also pull in these requirements into their own policy and procedures manual. And that is what GOEA will have to do. And that's what we will do. That's what we are already started getting ready to do. So once we get our policy manual updated with those regulation changes, then there will be a push to get the information in the hands of you all. Just one moment. I'm sorry, guys, just a moment. Okay, sorry guys, sorry about that. So with the new regulation changes for the ACL policies and procedures, that's the general policy that applies to everything we all do here as far as aging network services. That means that OEA needs to update our own policy manual and then disseminate that information to you guys. So we are going to parse through that information, get our documents updated, add them to our website for accessibility, send you guys a notification, and then we'll do something like this if that's what, we feel is best for you all, to put you all on the same page with what ACL is expecting us to conform to. They have a deadline date on that of October 2025. So just so that we are prepared to implement these rules and find any loopholes that are not efficient enough for us, we will start implementing those as soon as possible so that we're already in compliance come that October 2025 deadline for being out of compliance and starting date for being in compliance. And I don't think I said this, but if everyone would please put their name and their affiliated agency in the chat box if you have not already done that, so that we know who's here and who's come. I know there are some phone numbers, but once we, you put your name in there, it'll show who made the comment. If you're not able to do that, once we open up question and answer, and after I finish speaking, some of those individuals, when I see phone numbers with, you can unmute and tell us who you are. So with the change for ACL, that's going to require us to get with you guys and make sure you're all in line. So your service deliveries are following the allowable process that makes sure you receive your funding and you do not have to return your funding. So it's a big major change. I don't know when the last time there was a change to ACL regulations, but I do know the new regulations take effect as of March 15th. So from March 15th until October of 2025, the federal partners are giving us time to ensure we have all of this situated. So on top of doing the regulation updates, we also have a well sky system update. So again, we're here to, I want to make sure I give, and this is, like I said, this is my 5th call with the network. So I have already spoken to the bulk of the network as of now. So I'm giving you the same thing I'm giving them, and this all affects every agency, every situation as far as the agent network for Louisiana. The Well Sky system itself is a whole separate update that folds right into those ACL regulation changes. And Well Sky is one of the data unit providers that the majority of the United States uses. So we have had Well Sky for our data unit tracking system since I started here in 2007. I think it used to be called Harmony or SAMS of some sort. We are still going to stick with them, and they have been very helpful to make sure our system agrees with these federal policy changes that were coming down, but were announced to us, like mid-February. Us as the public, the general public, mid-February. So that build out will involve a little chaos for you all. It may have been already a little chaotic for some of you, because we'll get an email from Lauren, who joined our team, and she's learning this whole process also in a way that will benefit you all. But you'll get that email from her that says, I need your report to be updated, changed. These are the errors. And that is due to the difference in what the federal government has not been receiving from you, not have been receiving from you, versus where they're going with what they want to receive from you. So they are looking for you to provide this data to legitimize the funding that they are assigning for aging network services. So I know it can be a lot. Lauren also knows. Kayla was there in the thick of it, helping her with it, and she's still there. Actually, Lauren, Kayla, Sherry, and myself, and Lakeisha, when she needs to stand in for me, we do weekly calls with Well Sky so that we can build this system out for you guys and make sure it's user friendly. It doesn't have any holes for as far as we can tell, and it does just involve a bit of changing up what you're used to. So we'll be doing a lot of reaching out in the next, definitely through the end of this fiscal year. We're just going to start there, saying that we need you to know this, we need you to do that, we need to update this, and we need to change this. So I'm going to bring you all together to explain what we are looking for moving forward, what we're looking towards also moving forward. You'll take a moment to notice in each of your individual agencies, those individuals that I asked to be on the call, even from the little cover sheet on the survey registration link, those certain positions it suggested you have joined this call. Also, your program managers, your finance people, definitely your SAMS individuals, all of those positions that are supportive of getting the services delivered. Those are the key positions and individuals that will support the efforts that your agency will need to take to get on track and stay in line with these new regulation changes and these new system and software updates. So depend on your team. Here at OEA, we are depending on one another as a team. I have my entire HCBS staff that helped me figure out what we needed to do to better support you guys in the field. And then also have the other departmental staff from compliance and planning, and Sherry and her team, and then accounting and finance, that we depend on to receive data from them or vice versa, so that we're all making sure we can get you the best supports. So although I know it's been pretty chaotic, especially given COVID, I have to tell you, it's going to remain a little chaotic until we get to the end of some of these change and upgrades. But we are here to help you and support you in any piece of what we discover is important, which means any piece of what you all discover is important. You can let us know if you have any questions or issues by shooting your program monitor an email, and then we can essentially assist you in making sure you're in the right direction with just about any question you're going to have. But when we're going through changes of this magnitude, it leads to just sheer discombobulated chaos. Sometimes you don't know if you're doing the right thing, and it's the thing you've been doing all along. So this call was just to make sure you all know that we understand, we're here for you, but we will need to impose upon your time a little more frequently than we probably have been able to even before COVID, but definitely during the COVID issues, because we want to get all of our agencies situated to be in line with compliant policies and make sure that you spend your ARP dollars. So we're going to touch on ARP dollars also. So the WellSky changes do involve addressing the LILA form. So if you are using a certain LILA form, which should be the LILA long form or the LILA short form, the last effective date on that was like 17, you would still be using the existing LILA form that you're using. Now, prior to yesterday's session, I was notifying you all that we talked to WellSky about the fact that you guys are unhappy with the LILA form. It's not user friendly. It doesn't flow well with the input system. And then after yesterday's afternoon session, one of your fellow area agencies on aging, which is St. Tammany, shared some documents with us. So we're in the process of vetting those, and we may have some updated LILA forms for you a lot sooner than we thought. So I know the LILA form has been an issue for several agencies, and also the National Family Caregiver Supportive Services form, the assessment form for that also is a separate form. We have discussed these forms with WellSky, so we are aware, but to move forward, we're going to continue using what we have until we issue the updated form and give you the go-ahead. Please switch to this document instead. We have our GOEA website that's been under construction for a revamp that is now up and running, and we will be utilizing that website to share these documents with you on a more 24/7 accessible basis, aside from you needing an email and us emailing it back to you. So if there's anything that we're going to issue or provide or require or request that you please switch over to this and use this and not that, we will have that on the website for you, and the notification you will receive is, hey, the document is live on the website. Please download it and use this one moving forward. The website, the changes to LILA form, we'll go over that. NFCSP, providing your Title III services. We're gonna go through the Title III service provisions where we are now. Right, the entire process of getting through COVID really magnified the fact that we had some confusion as to what we needed to do as far as this extra Title III COVID related money. So for the aging network as a whole in the state of Louisiana, our structure is like so. We have multi-parish area agencies on aging. We have single parish area agencies on aging / councils on aging, and then we just have parish councils on aging. There is one entity for each parish, but depending on which entity you are, your structure is positioned in one of those 3 different types of categories. For your AAA agencies, your area agencies on aging, those are the federally obligated agencies that receive federal funding, and they have an obligation to meet the federal requirements within that ACL regulation. For your single parish AAA / COAs, they have that federal obligation to receive federal funding and meet those federal requirements within their respective parish, but then they also get state dollars because they're councils on aging. So when you have no AAA designation, you are strictly just a parish council on aging. And if you have no AAA designation, you are paired with an administrative area agency on aging based on how your location is. So for the 3 multi-parish area agencies on aging, they have a council on aging in each one of those parishes that they're federally obligated to provide in, and they work together in a contractual relationship to make sure the AAA can meet the federal obligations for that entire service area by locality. So that's one very important relationship that exists, because we want to effectively provide services to all of the residents in each one of the parishes, but there has to be an area agency on aging responsible for the receipt of the federal dollars and setting that federal plan for those funds. So that in the federal programs that we're all administering these service deliveries under are just 5. You have your Title 3B Supportive Services Program, your Title 3C1 Congregate Meals Program, your Title 3C2 Home Delivered Meals Program, and your Title 3E National Family Caregiver Program. And if you are they have a Title 3 Area Agency on Aging Administration funding source, but that is strictly what it means, administration funding source. The other 5 programs that we're doing, B, C1, C2, D, and E, those are the only programs that you guys are supporting with your actions and with your funding sources. When all the COVID money started coming down, it gave the impression that you are needing to operate a CARES program alongside your regular Title 3B program, and then an FFCRA Title 3B program, and the same likewise for C1, C2, D, and E. And then comes the ARP funding, and now you got another program of funding to operate. But the disconnect there and all of the actions we took here at OEA trying to figure out what was really causing the disconnect, it was the fact that we just needed to kind of slow down and give you guys some more visual supports or verbal supports. And then honestly, y'all, it just moved so fast. Every time we tried to do it, it morphed into a whole nother pot of money. So we were very appreciative that the federal government decided to assign these dollars and put them out specifically for the aging networks to survive off of. And now here we're at the end of it. And we just want to make sure that we get all of those last COVID dollars expended, and we are doing it with the regular routine Older Americans Act policy guidelines, not the expanded COVID guidelines. So that's the 5 traditional programs and all these funding sources that were provided to support those programs. There's a lot of question as to what should we do with our money. And the starting point is to know exactly what you can do with your regular Title III program dollars. That's the exact same thing you can do with your COVID-related Title III dollars. You just do more of it because you have the more money. So you do transportation with your 3B dollars and you're doing about $30,000 of transportation. You can do additional $30,000 of transportation with your ARP dollars. And the expanded COVID service delivery alternatives have ended as of now. So if you're doing any alternative COVID related service deliveries that have not been verbally or in writing approved as well by myself or your program monitor or someone from GOEA, you should not still be doing that service. If you are doing that, you shoot your program monitor an email so that we can follow up with you and make sure that you are not, that you're aware of what you need to be doing, and then we can assess anything to make sure you're not in a gray area of unallowability for actions that you've taken up till now. And going back as far as like July 23, not like definitely from July 2023 up until now. You should be on your routine service delivery path, not your alternative COVID service delivery path, unless you have prior approval from us. So the federal government released all of the COVID hold harmless options that we have. So we've moved back per the federal government's directive that those are now ended. What they did offer was to expand and or relax their acceptance for some of the things that we were doing. And most of it falls within the nutrition program. I'll find my text on it. So within the nutrition program, we were doing the grab and go meals. So for grab and go meals, those are still allowable. They're no longer considered a COVID alternative method. They built that into what is routinely allowable for meal deliveries. The struggle point that we all need to be aware of, some of us are experiencing this and needing to discontinue grab and go completely or they have it very limited, is that grab and go needs to be assessed in a manner that ensures you're not busting your budget and overspending just to offer the grab and go, and also that you're not misaligning your compliance for senior center operations. So the rule for senior center operations says that you need to operate at a minimum of 4 hours a day. And if you're operating your senior center to an empty building and just a couple people slide in and pick their meal up, and I said, well, a couple people, it could be 25 to 30, 50 people just stopping in and pick their meal up and moving on. That's not what the offering of grab and go is intended to do. So you don't want to find yourself in a position where you're not actually doing a congregate setting for the seniors to enjoy, more so than just being a drive-through for them. I'll share my my screen right now for the taxonomy update that I'm speaking on now. So for on the GOEA website, we do have this taxonomy, and I update this taxonomy every 4-year cycle. And then again, for any change that is necessary for you guys to have a reference point. So for the meals information I mentioned, this taxonomy already includes the grab and go reference for congregate meals, and it gives you a link to it. But I do need to correct the link on this one because it'll take you straight to some ACL nutrition website information versus you just having only this definition that's listed on the taxonomy. For some of the agencies that are doing grab and go, the bulk of the need to continue it is that people really want it, they've been looking for it, and they really, really enjoy it. But also with addressing your service deliveries and considering the ARP funding that you have left, we are already in a position to need to scale back on our services. So there is a supplemental form to help you address your grab and go needs and the delivery of your grab and go, and that is the decision tree. There's also information on this taxonomy about the decision tree here, and I also have the decision tree form pulled up so you can see it. Like I said, my link is not working, so I'll have to correct that when I load it to the website, but I'm going to show you the decision tree on this. From the Nutrition and Aging Resource Center under ACL, they developed this form, put it together based on listening sessions that we all went through, and it literally walks you through whether your delivered meal is a home delivered meal or a congregate meal. You know, traditionally before, if it was a delivered meal, it's automatically a home delivered meal. There's no question about it. And it walks you through whether your grab and go, drive-through, carry-out meals are home delivered meals or C1 meals. So use this tool to know when you're cutting back your services, you're not just going to eliminate grab and go because it's not, you got too many C1 meals. That's usually a better example. You just eliminate grab and go because you got too many C1 meals and you need to put more funding into your home delivered meals. But depending on this decision tree that you see, you could be possibly having a grab and go meal that's actually considered a C2 meal. So look at what your agency really needs what's beneficial to your agency and give this decision tree a look just to make sure you got your meals coded to the right Title III program and you're not missing the opportunity to balance properly. For the other COVID related service alternatives, there was the option to cover home delivered meals with your 3B supported services funding and your 3E national family caregiver funding. But again, COVID alternatives have ended, and there you should not be covering the cost of meals with Title 3B or Title 3E unless you have had verbal and then written communication from myself or your program monitor about the need for that. Whenever there is an emergency, which is how it's stated on the taxonomy, those options will be made available to you, but it has to be an emergent situation, not just a means of, I just need somewhere to, expend these dollars. For the home delivered meals service delivery itself, the option to trade your funding sources for the cost came about during a COVID related need to ensure you guys did not have a lot of chaos when you were trying to cover the cost of meals to start with. So, in the beginning, they told us everything was COVID-19 home delivery and they made it so easy. And then after they opened it back up and said, okay, you guys need to start recording C1 meals, the federal partners that set these parameters, they must have received a lot of calls about how beneficial it was to be able to offer the grab and go and have a little expansion of how your home delivered meals reaches your clients. So make sure you're comfortable with your meal delivery system. It is one that has gone through a lot of changes since because of COVID. Keep rolling past it. Say Title 3D. Title 3D is another one of our title programs that has a bit of a struggle for you all. They were not prepared to deliver any of these remotely at the onset of COVID. But now at this point, they do have options for you that include remote delivery, in-person delivery, and they have further expanded their options to include programs that do not require a facilitator. So this will be another piece of information that, if not already on the website, I will have added to the website a list of Title 3D HPDP service offerings that do not require a facilitator, and then a full list of all approved Title 3D health promotion and disease prevention service program offerings, which in short are evidence-based programs. Those will also be included on the website. So if you are having any issues with delivering a program in the Title 3D program area, please send your program monitor an email to let them know that you need assistance with Title 3D HPDP program delivery, and we can go through some things with you and make sure you're all set for the close of this fiscal year. Okay. And just this document in general, and go back up to page 1. This document in general, if you're not familiar with it, it is on our website already. It is our GOEA taxonomy. It lists all the services that can be offered by an area agency or a council on aging in contractual relationship with an area agency in the state of Louisiana. Whenever the plan was written for the service area, which is the parish, the service offerings are reviewed and then they're selected from by the agencies. So therefore, this actual document, this taxonomy itself, is every one of the services that are available they could have selected from to offer. At this day and age, post-COVID, and given the state of the economy, the financial aspects, the economic aspects, all sorts of different elements come into play right now for the bulk of you. You may find yourself in a position to reassess the service offerings that you are currently delivering, that you have delivered in the past, and then what you should be moving towards delivering. You are not by yourself. This is every agency. So if you do something really, really well, you definitely want to keep doing that. But if you do something that is a struggle point for you, it's not effective, it's not being received well, although you may really want to do it and have it available, is it financially beneficial to you, or should you put it on pause? Or should you allow that service to be provided by a different organization? Those are the type of assessments that you want to go through amongst yourselves within your agencies to determine, are we rating employees and doing what is most effectively efficient so that we can reach the ones most in need. Okay, so I get the decision tree. Okay. So that's the part of the services that I wanted to really touch on with the entire network, to make sure everybody knows that for when we know it's difficult, we do. And if you're having a lot of difficulties, please call us and let us know. Well, send your program monitor an email, because I'm compiling a list of those agencies that I need to address, and I start them as soon as I can get to them. The few I got yesterday, I think I've already at least scheduled a call or made a plan to follow back up with them with pulling some data per their requests sent via email. The ARP dollars that are associated with your service deliveries. If you are having issues and you have not been in contact with your program monitor about any issues with expending your ARP funding, you can shoot your program monitor an email and tell them which of your Title III programs, out of the 5 programs, which are you struggling with the funding, the ARP funding for. And we will be back in contact with you with a solution for how you can expend those Title III ARP dollars. Those dollars expire September 30th, 2024, and there is no additional opportunity to expend those dollars. So our goal as a network is going to be June 30th, 2024, which is the close of our fiscal year. So that you know for sure, without a doubt, that you have your ARP dollars expended and you will not be needing to return the money to OEA. Let me see, y'all. I got ARP dollars. I'm a well Sky. I'm checking my notes, make sure I touched on everything. I always feel like I forgot something once I get to this part. Okay. All right, staff. What did I forget? Somebody even give me a jog my memory right quick. We talked about the ARP dollars, the changes coming. Oh, for Well Sky. I'm sorry. Let me do mention. For Well Sky, when we do roll out with the new Well Sky system upgrade, Well Sky is going to train our staff so that they know exactly what's going on and walk through it with us. And then we're in turn going to give you all some training, like hands-on training. Really need to reach out to your SAMS coordinator or the individual that's responsible for or familiar with SAMS, and possibly, very possibly, a backup or two, so that we know everyone is familiar and understands how to move within the SAM system and record your units of service as efficiently as possible. Now, the process that we walk through with Well Sky right now is on target, it's on track, and we do reach out to certain agencies depending on what we need for our testing environment. So, and once we get ready to roll out the new program for all of you, we'll have to do it in segmented pieces. So there will be a group of agencies that we'll pair together and pull you in, versus doing the entire state at one time. So, Nina, you have something for me?
Assessments. I think you forgot to talk about assessments.
Thank you. Yes. I don't know why that's not on my list. That's one of the biggest things. Okay. So Once we do that, we'll do that interactive hands-on training with you guys and make sure you're comfortable with the new WellSky system upgrades. Just like we're gonna make sure WellSky make sure we're comfortable as well. I don't do Lauren's the expert there. I'm gonna be there to support her. I'm gonna stand behind her. She's gonna show me some stuff, but she'll get you situated, and I can always ask her a question. The next big thing that will come from GOEA is getting back in the field for you guys. And we'll do that with our program audits and our program assessments. For the program auditors, they are already moving in the field, and they're going to follow the regular routine procedure of notifying you about 30 days in advance or so that we're going to come out. This is the week. We're going to need these documents first, and then we'll see you on site. For the HCBS program monitors, we will not be able to give you that much notice before we come on site, that long of a notice. At best, we will shoot for a 5-day notice, but part of the program monitor program assessment is that we see and observe the Council on Aging activities occurring in the moment, as well as when we do get on site, the program monitors are required to pull those files needed themselves. So although you do have some interaction and inconvenience with welcoming an outsider onto your site day-to-day operations, moving right along, and then you got a program monitor show up and says, hey, I need you. Once we actually get started with the process of reviewing information, the idea is that you can continue moving along through your operational day if you just point them in the right direction. They review your files and they give at the end of an assessment. It's just an assessment report that indicates where you could improve or what you're doing really great. And if you want to improve even further, do this thing, or everything's just in order. And we'll do those for as many agencies as possible through the end of the fiscal year. Now, the idea of the program assessments going in as we get started back is a preliminary. It's like a screenshot of this is where we are right now. This is where that agency is right now. So once we get the preliminaries out of the way, then you will see us again, because we'll roll back for a full-blown, we're doing a full-on program assessment, and this one's not super preliminary at all. This is what we got to do. Okay. So for the start date, it's very possible we won't start until the end of March. But like I said, because I'm just considering the dates and times, the last week of March, when we come out, we will let you know, hey, we're going to come, we're going to do a program assessment, and we'll work and balance scheduling as needed so that we're not interrupting your day, but we're still able to achieve the review, observation, and monitoring of your service delivery, so we can give you that written feedback to work with and share with your board members if that be the case, share with the public, whichever needs to come of the results of that observation task. And so at this point, do you guys have any questions or concerns that you would like to share or discuss while we're on the call? And say no. I know out of all the sessions, most of the time everybody had to have it like soak in on what we're doing, what we're moving forward to. How much contact is GOEA going to give me? It is so unknown, but it will be at levels that you have not previously had to insert into your day, but we will definitely be a support, more so than just another obstacle to overcome, because we're all getting realigned so that we can stay in compliance with the new ACL regulations. And from, GOEA to all you out in the field, we really, really appreciate you doing the work that you do. It's very purposeful, very needed, very much so appreciated by those that receive it. And we at GOEA also appreciate it as well. we are, as a network, from you all in the field to here at the GOEA office, all of the GOEA staff members, we're all in this together. We're working as one in different locations in order to make sure we meet the needs of the residents that are eligible to receive these services, and actually preparing our agencies to receive those newly aged residents that become eligible to receive services. So if you have struggled moving through COVID with this, if you're new to the aging network, whatever whatever it is that may be holding you in a place of concern about, are we getting this done, and are we getting this done the most effective way? You are never ever by yourself, and you have a neighboring parish, you have a colleague that's right there you can depend on. That was the primary reason for me asking for not just the directors this time, but also those key staff positions and the individuals filling those key staff positions to join the call, so you can know that someone else has your back. And if you miss a piece of that, someone else may have heard the piece that you missed. So we can all make sure we're working together and we have the opportunity to come together and discuss things that are concerning, because it's probably not just your agency that's dealing with the concern. I think it goes faster every time. Okay, well, that is pretty much all the notes I have, given where we're moving. Oh, I'm so sorry. There will be some new forms. I keep forgetting these forms. The Lila form distracted me this morning, y'all, because that was a big form that we've been trying to get situated for you all for a while. But for the new forms that we have, I'm working on some updated financial reports, because that also led to a bit of confusion for you all in the network completing your monthly and quarterly financial reports. Where am I putting this art money? Mostly the monthly financial reports. So I'm working on, with Camille's guidance and discussions through our accountant manager that works with the program auditors, we've been discussing what we can do to change some of the forms to make it more user-friendly and less time-consuming for you. So some of the contacts you will get from us will strictly be, hey, we just updated this form. We need you to go to the website, pull this version down, and use this version moving forward. So again, GOEA in your inbox a lot, moving back and forth, giving you these directives, asking you to convert to doing this thing versus that thing. There will be plenty of it until we all get on the right page. Now, the one thing I can say for sure, if we roll something out and you've already completed the task, we are not looking to inconvenience you any further and have you redo something just because I might have been ready to roll it out tomorrow and you finished yours yesterday. That doesn't warrant you needing to change what you did, because I don't want to monopolize your time. And we roll on a accrual cumulative basis, so I can catch you the next month with your newly updated forms. So the introduction of the forms is for, let's get it out there. Let's see if it's really worth using. But by July of 24, we are aiming to be all set with our new documentation, so you guys can start that year pretty strong. And we are hoping to finish this year pretty strong. Our very most important, I'll say that, our most important task is ensuring you don't return any of your art dollars. So all of that rolls right into one another. There is overlap in every angle. So you getting your service delivery situated means that you're expending your art dollars. You are making sure you're utilizing the updated forms. It's giving you a better picture of the funding that you need to ensure that you've expended and not have to return it. I just had a thought and it ran away from me. Thing on it. I had a thought, some part of my mind, but it's gone now. So again, floor is open for comments and discussions. I'm trying to look at the chat box right now just to make sure I haven't missed anything. I should have scrolled down. Thanks, ladies. They remind you about the assessments. Okay, I got that. So we're all set. And we have any questions? It's okay if you don't have any questions, but if you do have questions, I'm sure your neighbor might have a similar question. All right, well, this feed will stay open until right about 2:30. I will be doing this again for a group of individuals. Well, what I'm doing is an attendance assessment. So once I've pretty much reached everybody that signed up through the registration link, then I will discontinue the sessions. But as of right now, I know for sure I will have some attendees for a 9 a.m. session in the morning. And I have already set it to allow for a 11 o'clock a.m. session as well. But it will be the exact same information. The only new development that came out of every session except the very first or second session was that we have an updated LILA form alternative that we will be able to switch to a lot sooner than waiting for our WellSky project to roll out. Well, thank you for joining me today. I hope it was not too much information, but I also hope it was just a refresher it's beneficial and helpful, so you know where we're all moving forward to. And if you have any questions, please email your program monitor. They are going to share all of this data with me so I can have my list of what to do for which agency and get all of us situated for our June 30th closeout and our fiscal year 25 start up.
you.